Hi, I'm Dr. Vidya, consultant pediatrician at Women's Center by Motherhood Coimbatore. Very happy to be here today and thanks for the opportunity. To tell you briefly about our pediatric department, we are a vibrant team of 4 consultant pediatricians and 4 to 5 pediatric registrars, ably supported by a great nursing team, and we also have physician assistants to support us. So we are happy to say that we are one of the few units in this region to have 24/7 presence of a trained pediatrician in the hospital. This enables us to deal with pediatric emergencies immediately and to also deal with children who need assistance, and parents' concerns are addressed immediately any time of the day or the night. So this is one of the highlights of our unit. So we have facilities for both pediatric inpatient care, which includes hospitalization of children who need treatment for common illnesses. So we are able to provide pediatric inpatient care. We also have a Pediatric High Dependency Unit where children who need continuous monitoring or respiratory support are able to be admitted here. So that is with respect to our inpatient services. Our outpatient services, we have a consultant-led outpatient service until 8 p.m. in the hospital, after which the pediatric triage and pediatric outpatients is taken up by the night pediatric registrar, and the consultant is also available on call. So a 24/7 trained pediatrician's presence is one of the highlights of our unit in this region. With that small introduction, as in all specialties, especially in pediatrics, health promotion and disease prevention is key, along with early detection of illnesses in order to manage them appropriately. So for health promotion, one of our key features is breastfeeding. So we have this baby-friendly initiative, which we are very proud to say that we are one of the units which have the highest breastfeeding rates in the country. So over 95% of our newborns are being exclusively breastfed. That is possible because we have our lactation team, which is actually led by consultants. We have pediatric consultants, pediatric registrars, physician assistants and nurses, all actively supporting our new mothers and managing common difficulties associated with lactation. So that is one of our highlights. We also promote early skin to skin, and we initiate breastfeeding as soon as possible for all newborns who are born in our unit. So this is within 30 minutes as a standard practice for almost all well newborns. That being said, we also avoid use of any other formula or any infant milk substitute unless medically indicated. We actively discourage use of bottle feeding, and we also don't encourage use of teats or pacifiers. And we have an education program in place for our new mothers. So this starts from pregnancy onwards, where we counsel parents and we tell them what to expect and what are the common difficulties that they may face in the immediate postnatal period. So when they are aware of it, they are more likely to follow this very important practice of exclusive breastfeeding until 6 months of age. So we also have training initiatives where we keep our staff well trained, and we have a well documented hospital policy which actively supports breastfeeding. So that is one of the most important baby friendly initiatives and health promotion initiatives that we have introduced and we have maintained in this hospital. So health promotion being key, the next is disease prevention. With respect to disease prevention, vaccination is one of the most important measures that we can take in order to prevent communicable diseases. Vaccination is being offered to all children of all age groups, from newborn until infants to young children to adolescents to adults also, and we follow international recommendations and IAP recommendations for immunization. So that is with respect to disease prevention. We also have developmental surveillance clinics where all children who are walking into our OPD at 2 months, 4 months, 6 months, 9 months, 18 months, with every outpatient visit, we chart their development progress. So we are able to identify developmental delays as early as we can and institute corrective measures. The other thing that is often being emphasized is early detection of speech delay and other developmental concerns, and we actively discourage use of mobile phones, and we try and educate our parents to minimize screen time as much as possible. Nutrition education is also key for us. So we have separate clinics where we discuss only breastfeeding as well as nutrition from the age of 5 months onwards. So we have ideal practices implemented. We try and maintain exclusive breastfeeding until 6 months of age as per WHO and all international recommendations, and after that weaning is slowly introduced, and that is also we promote infant-led weaning. So that is in gist of what we routinely do. There is much more to be said, but for dearth of time, let me finish here. So if there's anything else, we can get back later.